Hello, this is Ellie Goodman, VP of Marketing at MeMD. I'm speaking with Dr. Nicholas Lorenzo, MeMD's Chief Medical Officer. How are you today, Dr. Nick?
I'm doing great. It's fun to be here with you.
So we have been getting a lot of questions from our clients, from our members about the COVID-19 vaccine. And I'm sure as a provider, you have had a ton of questions from friends, family, and all sorts of people reaching out to you wanting to know more about the COVID-19 vaccine. This is fantastic. This is what we've been waiting for some time now. So there's a vaccine. This is great, right? We're going to get life back to normal. Is that right?
Well, first of all, let me just say that getting a vaccine to COVID-19 10 months into the pandemic is nothing short of a medical miracle. And so all of those involved in making this possible. And not only do we have one that has FDA emergency use approval, but now two vaccines with more to come in January, more than likely. It is very amazing. And so what this provides for us is light at the end of the tunnel. So what an important point I want to make is that we're still in the tunnel, that we're still in the COVID-19 pandemic, but that we can see the end of the tunnel in a sense that is the end of the pandemic with these vaccines that have been approved and will now be distributed. And so, yes, there is hope, but certainly we're still in that tunnel, so to speak.
So we're still wearing masks, we're still social distancing, right? We're still washing our hands as often as we need to or should be. None of that's changing right now just because this vaccine is out to market.
That's absolutely right. And of course, very few up to this point have actually received the vaccine. And of course, we're hoping to ramp that up nationally. We'll talk more about that here in a few minutes. But very few have actually even received the first dose. And you don't have full immunity with the vaccine until you've received two of the doses in the approved vaccines we have today. And so we still need to be mask wearing, social distancing, washing our hands, just being very careful, meeting in smaller groups as opposed to big groups. And so that continues into the winter, into the spring, and probably early summer, when hopefully we're going to have most of the nation vaccinated. But at this point in time, nothing really changes as to what is recommended that we all do to prevent the spread of COVID-19, even as we just start to distribute the vaccine.
So great. When can I expect to get the vaccine? Right, I'm not an essential worker. When can I expect to be in line to get that vaccine?
And so the supply of vaccine right now is limited, and so that's going to be ramping up here over the next 2 to 3 to 4 months. And there are priority populations to get the vaccine first, and this of course makes sense. So the frontline healthcare workers, those workers who are treating COVID-19 patients, are at the head of the line, along with nursing home patients. We've seen a large percentage of the deaths from COVID-19 in the nursing home population, so they certainly are at the head of the line. And then folks who are 65 and over, especially those who have chronic medical conditions, such as heart conditions or lung conditions, autoimmune conditions, are in the midst of treatment for cancer. These types of people will be at the head of the line before the general population will get the vaccine. So there's a large number of people that are at the front for good reason, and they'll be vaccinated first, and then the general public will be vaccinated.
Great. So what could I expect when I get the vaccine? What's it going to look like? What's it going to be like? What's that experience going to feel like?
So the two vaccines that have been approved by the FDA to date are the Pfizer-Moderna vaccine and the Pfizer-BioNTech vaccine and the Moderna vaccine. And both of these are 2-dose vaccines separated by 2 to 3 weeks. And so you would get your first injection, and then you would get an appointment for your second injection at the time you get your first injection, again, 2 to 3 weeks out. And it's important that you get both injections because to get full immunity, you need them both. Of course, that involves having a sore arm, and that'll pretty much occur in everybody who gets the vaccine. And then about 10, maybe 20% will have some other mild side effects, such as maybe a low-grade fever, some muscle aches, not feeling well, decreased energy, for about a day, maybe two thereafter. That's about 10 to 20% of people, but 80 to 90% are going to have a little bit of a sore arm for 3 to 4 to 5 days, and that's the extent of it. There is some evidence that the second dose, you might have a more pronounced reaction to the vaccine, so maybe a more sore arm, maybe more weariness or muscle aches or not feeling well. But again, these are all short-lived, whether it be the first vaccine or the second, usually lasting 2 to 3 to 4 days at the most, and in most people, 1 or 2 days. So these are bothersome side effects, but certainly no reason to skip the vaccine as far as that goes.
So to understand a little bit better, can I get COVID-19 from the vaccine? Am I going to test positive if I have the vaccine? Would I test positive for COVID? How does that work?
And so the answer to that question, the short answer is no, you will not test positive for COVID-19. The reason is that when you get the vaccine, what the vaccine has, to put it in simplistic terms, is only a small piece of the virus that allows your immune system to create antibodies to that small partial piece of the virus that will allow your immune system to recognize the real virus if and when you are ever exposed to it. So think of it this way, that the vaccine is like the tire of a car. And so you eject the tire, your body, that tire is a foreign body. I'm going to create antibodies to that tire. When you're exposed to the real car, your immune system will recognize it because it recognizes the tire. Okay? But the tire itself, that little piece of the car, is not a car. It's not going to infect you. It's not going to make you sick. It's just going to allow your immune system to create a defense against the real virus when you run across it in the weeks and months to come. So it's not going to make you sick, and the vaccine's not going to make you sick, and it's not going to make you test positive in the COVID-19 test that we have.
So in the news over the last several days, been hearing a lot about a new strain of COVID-19 emerging, I think in England and a few other places. But I wanted to ask about the vaccine and any new mutations to the COVID-19. What does that look like?
And so, this type of virus that causes a pandemic very commonly will mutate. And what that means is that there are slight changes to the virus over time. And let me just add a little bit more detail to this and say the last terrible pandemic that we had was the influenza pandemic about 100 years ago. And I think all of us out there have heard about this in the last 10 months. And that pandemic took about 3 to 4 years to run its course. And so you might ask the question, well, why does a pandemic end? Well, what happens is that the virus that causes the pandemic starts to change. And the changes that occur typically cause the virus to become more contagious but less severe. And you might say, well, why does that happen? And the reason is because the original virus kills a lot of people. So it infects somebody, kills them, and they don't really spread it to anybody. The types of strains that survive are the ones that are more contagious and make you sick, but they don't kill you, so that then you can pass it then to other people. And in fact, that's what we're seeing with COVID-19, that these new strains that have been reported in England and in Europe and in other places are actually more contagious, but less severe. One other important point is that there's no indication right now that the vaccines that have been approved or are in development will not be effective against these new strains. In other words, the current vaccine will cover these new strains, these new mutations, no problem. So still get the vaccine, because even these newer strains that are being identified are going to be covered by the current vaccines. And one final point on this is that the vaccine makers have said, if down the road there are strains of COVID-19 that our vaccine won't cover, we can create a new vaccine in about 6 weeks that will cover that strain. So everybody should rest assured that right now the current vaccines will work against all of the current strains, and that, God forbid, if there is or are strains in the future that the vaccines don't cover, that the vaccine developers can quickly create a vaccine in a matter of weeks that will cover those strains.
Oh, that's great. That's great to hear. So what about so getting the vaccine? Any unique concerns that someone needs to be worried about? I'm pregnant. I have allergies. I'm younger than 16 years old. Is there anything like that that people have to be aware of before putting themselves in line to get the vaccine?
Lots of questions there. And so I do want to say that our MeMD virtual providers are available for any questions that patients might have pertaining to the vaccine. So that virtual healthcare is available through MeMD, and so please feel free to utilize that. And so addressing some of your questions, there's no indication currently that pregnancy is a contraindication to the vaccine, and so that should not be a concern. As far as severe allergic reactions, I think you've probably heard on the news, or many have heard on the news, about the rare allergic reactions that can occur with the COVID-19 vaccine. I already mentioned that about 10 to 20% of people will get milder reactions, again, muscle aches, not feeling well, maybe low-grade fever for a day or two. But there are rare cases, 1 in 10,000, 1 in 20,000, 1 in 30,000 of people who will have a more severe allergic reaction. For example, like anaphylaxis, where it's a medical emergency. And think about people, for example, who are allergic to bee stings, and they get that severe allergic reaction that can kill them. These reactions are very, very, very rare. And the important point here is when you go and get the vaccine, the healthcare facilities that you get them at, whether it be a pharmacy or a medical clinic, a drive-in clinic, whatever it might be, they all have protocols to address these issues if and when they occur, again, very rarely. And so typically what they have you do is wait in that facility for 15, 20, 30 minutes. I would recommend you wait 45 minutes to an hour. Bring a book, bring your smartphone, do some web browsing, and wait that period of time. If you're that 1 in 20,000 who might have the severe reaction, those facilities are going to have healthcare providers there to address the issue. So the most important thing is to wait. 99.99% of these reactions occur in the first hour, most of them in the first 20 to 30 minutes. So if you stick around and wait, you're going to have the help available there to you if you're, again, that very, very rare person who might, in fact, have a severe allergic reaction.
Great, thank you. So I want to just talk quickly about herd immunity. So I know we have been a lot of talk about that, especially early on in the pandemic. How do we get to herd immunity? How do we get past this all? So how does the vaccine help us get there? What does that look like, and what does that mean?
So herd immunity is one of the major goals of any vaccination, immunization program. And the idea is that you get a large enough group of people in a community who either have had COVID-19 or who've had the vaccine, where if you have an isolated infection of COVID-19, it's not going to spread because everybody around that person is immune to it, either again because they've had it or because they've had the vaccine. It's estimated that for COVID-19, we will reach herd immunity between 70 and 75% of people are immune to COVID-19, again, either by having been infected or by getting the vaccine. Some of these newer mutations, just to get back to that topic for a moment, have probably raised that percentage to about 75%. That's what some of the newer research is saying. And so once we reach 75% of the population covered by the vaccine, then we're going to have herd immunity. In other words, that herd immunity, again, is where if a single case occurs, that case is not going to spread because a large enough percentage of the population is immune to the infection. That's called herd immunity.
That's fantastic, and let's hope we get there sooner than later. We'd certainly like to be out of the tunnel, as you said earlier, instead of just seeing the light at the end of the tunnel. If I want to learn more, where do I go? How do I learn more about this, and how do I learn more about the vaccine and any stuff that you've been talking about?
Well, there's just an incredible number of informational resources on both COVID-19 and the vaccine, as you can imagine. the easiest thing to do for most people is do a Google search, and you're going to find just hundreds and hundreds of places you can go for more information. Probably the best place, I would say, is the FDA website. And the reason is it's well organized. It's got an incredible amount of information on the COVID-19 vaccines. If you actually want to review the detailed documents that the companies that are producing the vaccine had to submit to the FDA, these are all public documents. So, for example, you could go to the Pfizer BioNTech documents that they submitted to the FDA for approval, and you could read what the FDA read. All the data, all the information is there. So you can certainly get information on the vaccines from the FDA. There's also plenty of information on COVID-19 and the vaccines at the CDC website. And all of the vaccine manufacturers have detailed websites as well. So there's lots of places that you can get information on both COVID-19 and the COVID-19 vaccine. One additional comment I will make, I forgot to answer your question on age. So the first vaccine that was approved, that is the Pfizer BioNTech vaccine, is approved for people 16 years of age and older. And the Moderna vaccine is approved for people 18 years of age or older. So basically just adults at this time are approved for these vaccines. The goal, actually, the long-term goal for vaccine manufacturers is to finish their pediatric studies and get approval for their vaccine for pediatric patients in preparation for the next school year. So the hope is that we're going to be able to vaccine children in the summer and early fall in preparation for the new semester in the fall of 2021 for school. So that's the plan. We wanted to get adults vaccinated first because they're more susceptible to bad outcomes for COVID-19. So we've done that as far as getting the vaccines out there. And now we're looking toward getting children vaccinated this summer and early fall in preparation for the upcoming 2021 school year.
Fantastic. I know that's a big relief for a lot of parents out there who, who've either had their kids at home with them or have been sending their kids to school and really just hoping that their kids are safe. So it's good to hear that that's the plan and that's exactly where we're headed. So as we wrap up, I just wanted to know if there's anything else that you'd like to add, anything else that we missed in this conversation.
Just a couple of final points to emphasize. Number one, the vaccine is here, and it's going to be generally available to the public. I would estimate that would be the case in March, April, May, that we're going to start to see it be available for pretty much anybody who wants to get it as far as adults are concerned. Kids most likely will be vaccinated again this summer and fall. And during this period of time, as we're getting the vaccinations out there, please keep wearing your masks, social distancing, washing your hands, gathering only in smaller groups. The same precautions we've been doing now for the last 10 months. Continue as we get the vaccinations out there and we get to that herd immunity we talked about, and we get through the tunnel and we see the light, as we said.
Yes, let's get back to quote unquote
yes.
normal life here as quickly as possible. So this is great news. So Dr. Nick, thank you so much for your time and answering some of these questions. And we'll talk again soon.
All right, thank you very much. And everybody out there, stay safe and stay healthy.